When I look in the mirror, the first thing I see is my dark circles.
Okay.
And I see the puffiness here, and I feel like I always look like I'm tired when I see myself in pictures and stuff.
Okay.
My eyes are. So I would say my eye area is my.
Okay, that's
Number
what
one.
bothers you the most.
Mm-hmm.
Okay, well, I'm going to kind of just scrutinize you a little bit
Please do,
because there's
yeah.
there's some things we need to point out about your eyes. Go ahead and hold that so it's pointed in the right direction, so that we can talk about what we can and can't accomplish with fillers versus neuromodulators. So hold that right between us, right
Okay.
there. So if I'm looking at your lower eye, I see a little puffiness through here. We see a little laxity of the skin. You've got a couple little spots in what are
Yeah.
capillary hemangiomas. Those are little strawberry nevi. So you could use some filler to camouflage, but that really isn't the best answer in your situation. I think ultimately what you're going to end up wanting or desiring the most is going to be to lift it,
Mm-hmm.
which is surgery. So we're not talking about surgery today, but that's, if I'm looking at you, I think that's what's going to work the best. Camouflage would be to put a little filler in through here and underneath there.
Mm-hmm.
We would probably also put a little filler down through here just because of the hollowness that we're seeing underneath there.
Mm-hmm.
What makes you look a little bit more tired would be when the brow starts to sag, so we can make your
Yeah.
eye look better if we were to lift that just a bit.
Mm-hmm.
So the crow's foot muscles, called the orbicularis oculi, the corrugators, are the furrow muscles, are the two depressors. This one brings the eyebrow in and down, and this one pulls the tail of the eyebrow down. So the depressors make the eye look smaller.
Mm-hmm.
So how do you fix that? Well, you remove the depressor action.
Mhm.
So if we were to do a little bit of Botox in the crow's feet, a little bit of Botox in the corrugator muscles, which is the muscle that makes, go ahead and furrow like you're angry. You can see how the skin, it's attached to the skin right here, and it goes down and it furrows the skin as it pulls the eyebrow in and down. So if we were to put a little bit of Botox here, a little bit of Botox there, what would happen is the frontalis muscle, which is the elevator of the brow, would make your eyebrow go up. So that's called a Botox brow lift, and it's actually a real thing. Your brow goes up about 1.8 millimeters. That's not a lot, but it makes the eye look a little bit more open. So looking at your eyes, you've got some, quote, surgical issues. Yes, filler can help, but it's not really the right tool. It's more of a camouflage technique. And then doing Botox, I think, is a little bit better, would be an easier and better solution for what you're also showing to me, meaning that your brow's a little lower and making it elevated would make your eye look more open. And so my recommendation is that you do Botox here,
Okay.
because I think you'll see the good positive benefit. The risk is small from something bad happening. And then from the tear trough and the eye standpoint, we can talk about that in the future.
Okay.
It's
Yeah.
not the ideal, you're not the ideal candidate for that, but it will help. And you can kind of push off needing a blepharoplasty, which is a
Yeah.
medical term for an eyelid tuck, by having filler put around your eyes. It helps. But ultimately, that puffiness, the bags of the eyes, is something that requires removal.
Okay.
Camouflage only takes you so far.
Okay.
But I would suggest that to you maybe as a second option down the road. if you
Yeah,
do
and then
filler.
maybe I can do some
So,
of this
yeah,
stuff
you
down
can,
the road.
you can put it in the nasal fold. Next time, if you like what you see up here in the glabella with the Botox, we can put a small amount in your upper lip as well. But I want you to kind of test drive it. And see
Test
what you
drive
think.
it and then schedule some facials and talk to you
Yeah, we should talk about that, because I
Yeah,
think,
getting on a regimen.
yeah,
So I
if
don't
you
have one now.
haven't been on anything or had anything then, it really makes a difference in your skin.
Okay.
So, and how it feels and just
Yeah, I would love to do that.
firms
Yeah.
everything up.
We talk about it revving up the skin engine, increasing the turnover rate of the skin. It also has medicinal effects on pigmentation so that it normalizes the pigment that your skin is making. So turning it over, the skin cells are more youthful on the surface, and also the dead layer, we have
We get
a
it every
layer
day.
very thin.
Mhm.
Yeah, our skin is always turning over. The dead layer is thinner. That's actually protective. That skin cell layer is protective, so we need some of it. But if we don't have a lot of it and it's exfoliated, then we see those more youthful plump
Especially
cells
with your
on the
home
surface.
care. Your home care will go right into your skin.
Yeah, what we do in the office is about 40%. What you do at home is like the 60% of maintaining and keeping your skin in as good shape as you
Yeah.
can. Okay, so we're gonna put some topical
And I'll be
anesthetic
back.
on there.
Okay.
And then we'll put some ice on. I'll go out and get the medicine. Go ahead and furrow like you're very angry, and then relax. Here we go. Poke. That's the first of 3 on this side. Number 2. And number 3. And the other side. And again. And the last. You survived.
That was fast.
Yeah, it doesn't take very long at all. I'm gonna just keep a little flat pressure right there.
Okay. There you go. Flat finger pressure. Perfect.